right? You might have to do a lot of work. Depending on how many routes there is, they might want to use different kinds of instruments and different kinds of elevators to get to where they need to be. So those last elevators, the 301, 302, 303, that have kind of that scooped out, those are kind of specific to sort of get towards the ABCs. They're very similar to our next ones. Our next one is a straight elevator. The straight elevator, a lot of times will be similar to like a universal elevator. It might be one of the first things they go in with after they use the periosteal elevator. So your straight elevator is ultimately going to go in, loosen the tooth from the periodontal ligaments before the extraction, and to separate and lift out of the socket, okay? So it can go in, loosens that tooth from that periodontal ligament, okay? And can help to lift it out. It's really large, okay? The difference, this is a luxating elevator, okay? They look very much the same. The luxating elevator is much smaller. Yep, so it's smaller and thinner. It has a little bit of a cutting edge right at the edge. This is primarily used to cut that periodontal ligament. So remember that periodontal ligament, it runs the entire length of that tooth, right? So where that tooth connects to the alveolar bone, it's got periodontal ligament everywhere around the entire thing. So all of these instruments are helping to try and free that up, that there's a lot of ligament and it's going around the entire thing. So this larger one might not be able to get in there as well. This luxating one has a little bit more of this cutting edge right on the edge. That's going to be meant to really go through and take out any other periodontal ligament that might still be there. It's able to go in. You can go all the way in, rock it back and forth to try and separate that tooth from the socket. So see how you can see that that tooth is kind of popping out? So that's going to be the role of that. You need to know that the difference is that the straight elevator is larger in terms of identifying them, okay? All right, so next we have the T-bar elevators. Just another kind of an elevator to loosen the tooth from the periodontal ligament before the extraction, okay? They are paired. T-bar looks like a T, okay? You don't need to differentiate left or right. They will come as a pair, so you need to just know T-bar elevator, okay? The handle design is going to help you to see that it's just the left and right T-bar, okay? This will be a pair. So another pair of T-bars. So in an office, if somebody asks for the T-bars, they're gonna come as a pair, okay? So these are left and right T-bars. Then we have the 350 and 351 T-bars. We do not have a 350, okay? So the 350 and 351, so if you see that this is there by itself, it's a paired T-bar, but this is the 351. We don't have the 350. These T-bars will always be together, okay? So left and right will always be together. So if there's just one single T-bar on the, up here for the pass-off, it's going to be the T-bar 351. One way to tell the difference if both of them were here, this is completely straight. Can you see that?
Yeah.
So that's just a way to...
Which one's the straight one?
The left-right T-bar.
The paper says missing 351. The opposite.
Yeah, missing 350. Is that way off? I should have get that memo in the last class. No, didn't. so that's it for that.